If you are a South Asian and an immigrant, you have encountered this problem with your own families. How long are we going to keep quiet on mental health issues surrounding our family and community? When are we going to address different psychiatric disorders that lead to physical problems? And when are we going to have an easier life and reduce the injustice that South Asian women have faced and some of the elderly have faced? Welcome to the Patel Perspective Podcast. My name is Harsh Patel and I'm a PA student in US. In this video, I would like to raise awareness of the social stigma associated with seeking mental health treatment if you are a South Asian. First thing that we need to understand is the mindset in the West versus the East. In the West, individualism is really appreciated. If you earn more money, if you are independent, if you are financially well, if you have kids and if you support those kids, your social status is high. What that means is women here can succeed really well. In the East, it's completely different. Family and community are valued over individual. This interdependence is the core value of any family and community in South Asians. Now, there is a problem with this. The core problem is that when you don't value independence, what tends to happen is you are less willing to seek help with, regardless of psychiatric issues, with any issues, you will go to your community, you will go to your family, which is not inherently bad thing. But when it comes to mental health, your community might not be the best people to seek advice. And so after laying these distinctions out, I would like to get into some factors that create this social stigma. So you may be wondering, who are these people at risk? Young women, older women, so like your sister, your mom, the kids who are born to immigrant parents, and who are 65 and older, who have experienced some sort of social isolation and neglect from their kids, will tell you that mental health is real. Now, who does mental health does not affect in the East or in South Asians who are living in these white countries? It does not affect men like me. Well, it does, but what I'm trying to say is it doesn't affect mostly people who are patriarchal, who are the head of the household. So who will be head of the household? People who are in the range of 25 and 65 males. So these will be the head of the households, earning the bread. They will be taking all the decisions and calling all the shots for the family. They are not going to suffer from mental health issues. At least that's what they would say. I'm going to give my perspective on this a little bit later, but generally speaking, mental health issues more commonly occur in young women like your sisters, older women like your mothers, kids who are born to immigrant parents, and then lastly, older folks, 65 years or older, who are South Asians. Now, here are the factors. So the first things first, immigration creates so much stress because when you move to a different country, you have to speak a different language. You have to learn about the culture. You have to apply for jobs, actually. You have to learn how to apply for jobs. You have to maybe fix your style of speaking English. You have to find ways to reduce that language barrier. You have to find friends and like-minded people. And it's not the same as moving to a different city from, let's say, Jacksonville, Florida to Savannah, Georgia. It's much harder when you move from a country that has an Eastern mindset of interdependence and the value of collectivism compared to in the US, it's more about individualism. So there's a lot of this stress that maybe your parents have faced, especially like when I think of my life, my mom has faced when she came here. I remember she was working multiple jobs. And I mean, this is kind of the theme. I'm not saying my family is only the one who suffered a lot of stress. But like generally speaking, immigrant families tend to have more jobs. They have more stress. They want to earn more money. Initially, when they're transitioning from this older life to a new life in a different country, they're going to earn less. And there's an added financial stressor. And that creates a lot of anxiety, a lot of maybe like less depression. But the thing is, there's more anxiety in those populations. Then there's intergeneration family conflict. So, for example, there are 3 generations of people present in, let's say, US. The first generation moved to the States. They have the same core beliefs about family and seeking mental health treatment. Now that gets passed down to their kids who were born here maybe. They are maybe a little bit reluctant of seeking mental health treatment, but as they get older, they tend to seek treatment. But then the third generation people, actually they will seek the most amount of mental health treatment when you talk about their family members compared to other family members. And so the point is like, is some intergenerational conflict about this beliefs that go around in families, in South Asian families and other immigrant families. One of the most common diagnoses in UK was major affective disorder, which is depression. And some of the factors include our older age, literacy, financial difficulties, gender roles, and perceptions of illness. There is tremendous social stigma surrounding seeking treatment for depression. And all the studies that, or the concept that I'm going to talk about is primarily going to come from non-American countries, because there has to be a lot of research done in South Asians in America. And so all these studies are most likely done in UK, Canada, Australia, etc. The next thing is somatization of stress. What somatization of stress means is that stress inside your body creates physical symptoms. Let's say abdominal pain, headache, muscle tension, and all of those are treated and emphasized in your medical visits compared to your psychiatry. So this is more common in South Asians, where you have this underlying psychiatric disorder. For example, let's say anxiety. And that creates physical symptoms like abdominal pain. You can have headaches. You can have muscle tension, like neck muscles, muscle tension. Now, when they go to their primary care providers, they seek treatment because they have those physical symptoms, not because they have that underlying cause of anxiety. And so what gets treated is the physical symptoms of the stress, of the anxiety, or the depression. Medical providers are left to treat the physical symptoms without addressing the root cause. And sometimes our community will complain about American doctors not fixing the root cause. But how about we as a community be honest with our medical providers? How about we be honest that, hey, I am experiencing anxiety. I am experiencing depression. There is a gap of knowledge and an insight in our South Asian communities where they don't want to see a medical provider and explain anxiety, explain depression, because they see it as a sign of weakness. The point here is anxiety can be manifested as muscle tension and various other physical symptoms, depression as well. Another example is, this is a great example, anxiety and sleep. When a person suffers from generalized anxiety disorder, they can have insomnia, lighter sleep, increased wakefulness. All these factors are confounding. And so if South Asian person goes to their medical provider, says, I have sleep issues, they will be treating sleep issues. If you're not going to give your medical provider the full information, they are not going to address the root cause of the problem. When we look at some specific populations, like I said, some young South Asian women are at increased risk. We are talking about the domestic violence, physical abuse, and the verbal abuse, financial coercion, gender disparity, and social isolation they face. So there's a disproportionate injustice being faced by South Asian women, and that's why they're increased risk for mental health disorders. Some of the mental health conditions that are really common in South Asian women, especially young women, are eating disorders, depression, anxiety, post-traumatic stress disorder, loss of self-esteem, and suicidality. We have people in our family who are suffering from verbal abuse, physical abuse behind closed doors. And that is creating anxiety, depression, hidden eating disorders, anorexia or bulimia or binge eating disorder in these young women. I'm pretty sure if you open up conversations with our family members about mental health disorders, that they are not going to come out and share the specific personal issues they're facing because of the perception of seeking mental health treatment is a waste of time and they're going to be seen as a weakness. And now we also can talk about older aunties and older uncles who are 65 or older. Now, they are also being neglected because sometimes what happens is when kids grow up in a different country, they abandon their family members, they cut contact, they don't set up resources for them in terms of having a good shelter, healthy food. And what that creates is obviously social isolation, but also emotional neglect. But they have also already in their history, they've suffered from the immigration stress and the language barriers. So that creates an added pressure later in their lives. And so the number one mental disorder that they've experienced is depression. And that translates to hopelessness. And that translates to slower recovery from any physical illness, which then increases their risk of cardiovascular disease, meaning arteries in your body are going to be clogged in a faster rate, and also cancer. And so you can see how this spiral, how mental health is connected to physical health. And sometimes you have to treat the root cause of the problem. If you don't fix the root cause of the problem, you will create intergenerational conflict and you will keep believing in things that are simply not true. Talking about lying to yourself and pretending that everything is fine, let's also talk about alcohol abuse. Alcohol abuse is rampant in our communities. In fact, Hindus face the highest risk of acquiring oral cancer, aka squamous cell carcinoma of the oral cavity. And that is higher when we compare to Muslims and Jains. When you look at this deeper, alcohol consumption is the highest among the first and second generation Sikh male immigrants. And in fact, those people have the lowest awareness of alcohol causing cancer. So basically what I am getting at is like our community doesn't know the effects of alcohol on our body. And when we talk about women, so first generation women are least likely to engage in unhealthy alcohol use. But second and third generation women who have engaged in unhealthy alcohol behavior have an increased risk of breast cancer. As we have talked about before, one of the reasons why South Asian people do not seek mental health treatment is because they have this stigma of, oh, how am I going to be perceived as? Like, will my social status decline? Or am I going to be seen as weak? Are they going to see me as an outcast? That's number one. Number two is income. Mental health treatment access is a shit show in America. There is, I think, a great barrier in terms of acquiring mental health in America. And I can probably anticipate that in other countries like Australia and regions like UK, there is also barriers to getting mental health. But there are free resources out there. Like this video could be a great start in creating awareness. The other part of the income is our families really struggle to earn money. I know my family struggled tremendously when they moved here from India. And some of them had to have 2 jobs and they worked 7 days a week. And in that time span, you really don't have time and resources to put towards mental health. Lastly is religion. Whenever we have mental health issues or whenever historically my family has had mental health issues or other South Asian communities have had mental health issues, they would seek religious advice over advice from medical professionals. This is because I feel like religion for South Asians is a one-stop shop. You can get your spiritual needs, you can have your mental health needs. But to be honest, I have to say this, some subsect of religions in Hinduism in countries other than India are not supportive of people's mental health. They do more harm than good. There's more bias than actually real world applications to improve mental and physical health. I do think that if you are a true Hindu and if you don't understand the important scriptures like Bhagavad Gita, then you shouldn't be saying that I am a Hindu. Because the learnings in Bhagavad Gita about psychology, about mental health, they are much better than these new subsects of Hindu religion that have arisen prominent in the United States and other white countries. The purpose of this video is to raise awareness of mental health disorders and injustice faced by young South Asian women, older South Asian women, older individuals like your aunties and uncles who are 65 or older, and also ABCDs, American-born confused Daisies. And so there is a lot of injustice. And I hope this addresses all those issues of just the first step to fixing any issue is awareness. So that's why I made this video. Second is to reduce cultural stigma around therapy and medications. I have a therapist and it has done wonders for my personal life, my professional life. And I was so hesitant at first because of just being in a South Asian environment and culture and that mindset. Like you're always hesitant to try out the first line therapy of anxiety disorders or mood disorders. But getting therapy has changed my life in terms of doing my work more productively, fixing my relationships, feeling more secure and confident. Lastly, like medications too, I am now more willing to try medications because of the benefits I have seen in therapy. So if I go on an antidepressant, I'm going to make a review video of my side effects, my improvements, whatever I was facing. Lastly, this is also an urge to future providers to screen for mental health in South Asian communities more aggressively and fix the root cause if it is stemming from a psychiatric issue. And so if I go into primary care, I'm currently halfway through my clinical year in PA school, and if I go into primary care and if I have South Asian patients, I'm going to screen them really heavily on mental health issues like general anxiety disorder and depression using GAD-7 questionnaire and PHQ-9 questionnaire. You guys can look them up online. They're screening questionnaires. They are the most effective screening questionnaires to be able to say, hey, this person is suffering from anxiety and this person is suffering from depression. What I have found is if you fix your mental health, it is going to literally fix your life. And so if you are struggling with any mental health issue, and if you are South Asian, if you have not gotten help, this is your video to start getting help. F the money that it's going to take. Yes, it's going to take money to fix your mental health. F the social stigma. Be confident in your own decisions. And that is my goal of this podcast. So thanks for watching, everyone. I hope you like this in-depth, long video, long podcast. I'll catch you in another one if you like these. Take care and take control of your mental health.